Hi everybody, this is Dr. Murali Bharadwaj, your study mate, classmate, roommate, benchmate, table mate in your medical school preparation. Today I am going to make a very high topic, hottest topic, benzodiazepines, barbiturates, sedatives and hypnotics. You need to remember at least 15 to 20 most important points about this topic. And often for the medical students, this topic is a little bit complicated and vague. But this is the most high topic whether you are going for MBBS exams, NEET PG, FMGE, USMLE, PLAB, or any exam for that matter. Let us become the champions of this topic in the next 20 minutes. Party hard. Barbiturates, benzodiazepines, sedatives and hypnotics. Invariably one question is going to come in the tomorrow's NEET PG exam. So, the most important mnemonic that you should not forget. Short-acting benzodiazepines. Is there any way to remember? They have a half-life value less than 5 hours. Remember atom. A for alprazolam, T for triazolam, O for oxazepam, M for midazolam is what you need to remember. Then what are intermediate acting benzodiazepines whose half-life is 5 to 24 hours? Remember thin layer chromatography, TLC, temazepam, lorazepam, clonazepam. Then what are the long-acting benzodiazepines whose half-life is more than 24 hours? You remember C, D, E, F. Clorazepate, chlorodiazepoxide, diazepam and flurazepam. And also another favorite MCQ in the tomorrow's NEET PG is, even in the USMLE, any exam you go, benzodiazepines not metabolized by the liver and safe to use in liver failure. Remember OTL, out the liver. Oxazepam, temazepam and lorazepam. So are you going to remember this forever? Definitely. Tomorrow's exam hall, you will remember Dr. Murali Bharadwaj when one question comes from one of these mnemonics. Then, what are those benzodiazepines, which are metabolized through glucuronidation? Remember LOT, LOT, lorazepam. Oxazepam, temazepam, they're all metabolized through glucuronidation is what you need to remember. Now what are the adverse effects of diazepam? You can easily remember with diazepam. D for dizziness, dry mouth, disorientation, impaired vision, amnesia. It's more common in the elderly. There is a psychomotor skill impairment, ataxia, neonatal respiratory depression, night awakening. All these are the adverse effects of diazepam. Now 5 points about the barbiturates which you should not remember, you should not forget. Typically they prolong the GABA activity, they increase the duration of the chloride channel opening. Whereas benzodiazepines, they increase the frequency of chloride channel opening, barbiturates increase the duration of the chloride channel opening. You got the important difference? This is the favorite area. Barbiturates have a GABA mimetic activity, whereas there is no GABA mimetic activity for benzodiazepines. Barbiturates never plateau and they don't act act on the benzodiazepine receptors, and they are the part of the GABA A complex, the beta binding site. Now, how about alcohol? Alcohol is a CNS depressant. It also has a GABA mimetic activity, never plateaus. There are three enzymes important for the alcohol metabolism: alcohol dehydrogenase, aldehyde, acetaldehyde, dehydrogenase. Let's learn 5 important points about the benzodiazepines. Benzodiazepines potentiate GABA. They increase the frequency, not increase the duration, increase the frequency of the chloride channel opening is what you need to remember. Benzodiazepines, they do not have any GABA mimetic activity. That is the reason they plateau. Whereas those drugs which have GABA mimetic activity, they do not plateau. So please remember that. So how does benzodiazepines basically function? They act to the benzodiazepine receptors. There are 2 types of receptors: benzodiazepine 1, benzodiazepine 2. Benzodiazepine 1 action is responsible for sedation. Benzodiazepine 2 for the anti-anxiety, impairment of the cognitive function. That is the reason they lead to memory loss, which is anterograde, not retrograde, anterograde amnesia. And these receptors are the part of the GABA A complex, which is the benzodiazepine binding site, is what you need to remember. Now let us talk about the different benzodiazepines and what are their important therapeutic indications. Midazolam is the shortest acting. So preoperative sedation, anesthesia, we use the midazolam. Temazepam, oxazepam, lorazepam, they're all short acting. They're used to treat anxiety, because their half-life is about 6 hours. They are used in the sleep disorders. Lorazepam is also used in status epilepticus. And lorazepam is preferred over diazepam for this purpose of status epilepticus. Then where do we use diazepam? It is used intravenously. Its T-half is about 8 hours. And typically, whenever there is any alcohol withdrawal, so withdrawal states. Similarly, for muscle relaxation, to treat anxiety, preoperative sedation, etc., etc. Then finally, alprazolam. Every medical student knows this drug. For anxiety, panic and phobias, alprazolam is the one which is being used. Now, how about the phenobarbital? Let us talk about the barbiturates. Where do we use the barbiturates? Phenobarbital is used for seizures. It is long acting. It is safe for pregnant women with epilepsy. If there is a pregnancy and epilepsy, phenobarbital is absolutely safe. Similarly, for treatment of febrile seizures in children, intramuscularly we can use the phenobarbital. Then how about the thiopental? All of you know, this ultra short acting barbiturate is used for the induction of the anesthesia, is what you should remember. Now 5 to 10 common points you need to remember about the ethanol. Ethanol, how is it metabolized? Converted into acetaldehyde, which becomes acetic acid. Any intoxication with ethanol will lead to development of metabolic acidosis, all of you know very well. And all ethanol toxicity is because of the acetaldehyde component of it, which is the end product of its metabolism. So the hypertension, the headaches, etc. And persistent ethanol consumption is associated with thiamine deficiency also. Then acute alcohol intoxication, what will happen? There can be acute pancreatitis, fulminant hepatitis. It can be reversible with steatosis or irreversible with Mallory bodies. Mallory bodies is what you need to remember. Then how about the chronic alcoholism? Chronic alcoholics keep going into hypoglycemic episodes. It leads to lipemia, fatty liver, cirrhosis, muscle wasting. And also there will be lactic acidosis, chronic pancreatitis. And chronic alcoholism is a predecessor for the squamous cell carcinoma of the esophagus and also for signet ring cell cancer of the stomach is what you need to remember. Now let's talk a bit about pharmacokinetics. The liver metabolizes the benzodiazepines into their active products. But exception is lorazepam, oxazepam, temazepam. That's the point you need to remember. And if you take phenobarbitones, the liver metabolizes sometimes to active compounds, and phenobarbitone is a cytochrome P450 inducer. And for 5 years, barbiturates are contraindicated because typically they are inducers of the D-ala synthetase enzyme is what you need to emphatically remember. Now, 2-3 comments about ethylene glycol. Ethylene glycol forms glycoldehyde, becomes glycolic acid, becomes oxalic acid. Typically, it is a part of antifreeze and used for attempting suicide. In children, accidentally it is consumed. And all toxicity of ethylene glycol is because of the severe metabolic acidosis. And the oxalic acid, which is the end product, forms crystals. And it can lead to nephrotoxicity, it can lead to acute tubular necrosis, etc., etc. Now coming to the withdrawal. If you look at the benzodiazepines, the withdrawal of the benzodiazepine lead to rebound insomnia. Somebody who is regularly taking alprazolam happens to miss it. They will go into rebound insomnia, anxiety, sometimes seizures. And to treat that, you need to give a long-acting benzodiazepine. Need to be given. Similarly, if you look at the benzodiazepines, their withdrawal can lead to anxiety, agitation, life-threatening seizures, anything can happen. Now what are the drug interactions? Always remember, benzodiazepines always have a additive action with the other CNS depressants, like anesthetics, antihistamines, opiates, beta blockers. They're all CNS depressants, and benzodiazepines have an additive effect with these important drugs is what you need to remember. Similarly, if you look at the barbiturates, even barbiturates, they have additive effect with the other CNS depressants, and they induce the metabolism of the most lipid soluble drugs like oral contraceptives, carbamazepine, phenytoin, warfarin. They induce the metabolism of these lipid soluble drugs. Now, methylene glycol become metabolized to formaldehyde that forms formic acid. And it leads to a anion gap metabolic acidosis, which is very severe. Methylene glycol toxicity can lead to respiratory failure, it can lead to the ocular damage, it can lead to neurotoxicity. And you should remember fomepizole and disulfiram. These are the two important antidotes that need to be remembered when it comes to alcohol. So now what are the non-benzodiazepine drugs you need to remember? Z class drugs. Z drugs, you can remember Z for non-benzodiazepine, Z for zolpidem, Z for zeliplon, Z for zopiclone. They are all benzodiazepine 1 receptor agonists. They are used to treat the sleep disorders. They have less effect on cognitive function because cognition, that is learning ability, is all controlled by the benzodiazepine 2 receptor. Because Z drugs are acting on the benzodiazepine 1 receptor, typically they don't affect the cognition. And they have less tolerance, less abuse liability, Z drugs. Then buspirone, you should know everything about it. It has no GABA effect. It has a 5-HT1A partial agonistic activity. And it takes 1 to 2 weeks for it to show the effect. And it is used to treat the generalized anxiety disorder. That is the reason you need to remember buspirone. So finally, the summary you should not forget: sedative, hypnotics and anxiolytics. Benzodiazepines reach a plateau, and alcohol and barbiturates don't reach a plateau in CNS depression. It is the GABA A activation that increases the chloride influx. GABA B increases potassium efflux, and both will lead to hyperpolarization. That is what you need to remember. And what is the benzodiazepine antidote, doctor? Flumazenil. It is a non-specific benzodiazepine receptor antagonist. And benzodiazepine has no GABA mimetic activity. So, if they want to show their action when they act on the GABA A complex, they open the chloride channel only in the presence of GABA neurotransmitter. That is the reason their action has a plateau. Unlike the barbiturates, this is frequently asked in every exam. Whereas the barbiturates and alcohol, they have a GABA mimetic activity. Whether GABA is there or not, they are still capable of opening the chloride channel. That's the reason they don't plateau. They don't depend on the presence or absence of the GABA. And any chronic use of the barbiturates leads to tolerance. And there is a cross tolerance between benzodiazepines. If I am regularly taking alcohol, I will develop a tolerance to barbiturates. Barbiturates lead to psychological and physical dependence. And benzodiazepine, if you compare to ethanol barbiturates, it is less abused. And benzodiazepine 1 receptor is the one leading to the sedation, is what you need to remember. So, don't forget 5 important indications for benzodiazepines. Status epilepticus, intravenous lorazepam is the first line. And for this, they show high efficacy, rapid onset to treat the acute seizures. Then alcohol or benzodiazepine withdrawal, delirium tremens. Lorazepam and diazepam are both first-line agents. If the patient is having any liver disease with alcoholism and gone into alcohol withdrawal with delirium tremens, lorazepam is preferred to that of diazepam because lorazepam has no active metabolites and can be used in severe liver disease. Whereas diazepam has active liver metabolites which can accumulate and cause toxicity. That's the reason you need to be careful. Now, eclampsia. The IV diazepam is second line after MAC sulfate. And benzodiazepines can be used even as hypnotic. Hypnotic means sleep promoting. And sedative means anxiolytics. Hypnotic means sleep promoting. Hypnotic, it may be used in the treatment of insomnia. It decreases REM sleep. And midazolam is used to induce general anesthesia. And Benzodiazepines are also used for generalized anxiety disorder, night terror, sleepwalking. For sleepwalking, uh, diazepam use is there. So that is what you need to remember. Everything, anything about sedatives and hypnotics.